Going to the joints of the spine now, mobilization of the joints of the spine. We'll look at the discs. Discs are kind of a joint. And they're poroelastic, the discs, and they abide by the property of creep, so which means you can move fluid through a disc. And so we're going to mobilize some of these discs now. Lumbar spine, there's something called an internal disc disruption syndrome. By changing the dynamics within the disc itself, then I think blood flow increases, and a large part of the time this pain will go away. So I'm going to demonstrate the lumbar spine to you now in side glide. This is similar to a procedure in another clip when I'm doing the primary dorsal ramus. A little bit different because the spine's not in so much flexion. But again, the exact position is determined on how the patient feels. Now you notice I have the hips flexed somewhat. The reason why I have the hips flexed is I want the lumbar spine into some degree of flexion, because then when I bend it side to side, the zygapophyseal facets will not imbricate, so I can move to a longer, further range. You want to put your arms like this? Okay. Head up now, and relax. This belt's across the SIS, so I'm loading the discs in the lumbar and lower thoracic spine. I can add a little flexion, depending on which he prefers, and I provide the traction this way with my legs. I'm going to do that on the other side. Head up now. Head back and relax. Interesting, most people are a lot more flexible to the left. Now, if a person has low back pain, which side should I load the discs on? Well, most often it's the side that they feel more comfortable with. And secondly, it's the side where there's an increased range of movement. Now, you notice I'm not comparing the left side to the right side. If she had a greater range of movement to the left, that would mean I should load her on the right. It's not true. What I want to do is load both sides again and see which one increased in their range of motion. Okay, head up now. Head back, and just relax. Now, that's increased somewhat. Try the other side. And whoa, that's way better now. So she probably has a preference to the left, a directional preference to the right. That's loading the discs in the lower thoracic and lumbar spine from on a side glide. We can also load them in flexion and extension as well.